heart disease in Ayurvedic perspective. Though there are varieties of heart diseases, I am going to concentrate on the ischemic heart disease IHD leading to myocardial infarction, heart attack. This is well known for untimely sudden death and hence harasses with a constant stress of fear of heart attack. During the last 2 decades, the most common age of getting heart attacks is coming down and the youngest age I have heard is 12 years. Stress during the 10th and 12th standard examinations has led to hypertension in 10% students according to a recent survey. The competition, hectic life schedule, achieving targets, improper food habits, addictions and heredity are the main reasons behind this dreaded disease. Unfortunately, the modern treatment aspect has remained much mechanical and is not reaching the root cause and treating the disease. As a result, in spite of various achievements in surgery, the disease has still remained as a challenge for the whole world. Ayurved does describe 5 kinds of heart disease and symptoms of some of them resemble with myocardial infarction MI or ischemic heart disease IHD to a certain extent, but still the heart disease described in Ayurvedic texts is neither a major disease nor a fatal one. So, we must consider today's heart disease separately in Ayurvedic perspective. Let us consider the factors in Ayurvedic perspective. 1. Hetu or the cause. As mentioned earlier, hectic life schedule, stress, depression, worries, improper food habits, addictions, lack of exercise and yoga, obesity, heredity are the major causes for heart attacks. Especially those people who are in managerial cadre, working in any fields like IT, BPO, media, police, private companies, banks, etc. with a heavy work schedule, target-oriented work schedule are prone to this disease. If one overworks beyond the capacities without any support of a healthy lifestyle or relaxation, he is going to be exhausted, and when the heart gets exhausted, it being a vital organ can even lead to death. Rest or relaxation is an important aspect of one's daily life. The body and mind become fresh. They get their nourishment and one can work the next day. But if one is deprived of the rest, relaxation, it leads to fatigue and that can lead to conditions like heart attack. Other important aspects are stress, depression and worries. If we are working beyond our capacities or the target is too high or unachievable, or human relationships are not supportive, rather depressive, this all untimely leads to failure, creating more stress and more depression. Those who do not tolerate even commit a suicide or become a victim of heart attack. The unhealthy changes in the lifestyle and food habits worsen the situation. With the invention of the electricity, we have converted night into a day. One has to keep working till late in the night to complete a task. This leads to an imbalance of the natural cycle of sleep. Furthermore, home food cannot be availed in office and it is too late to have dinner at home. As a result, fast food like pizza, burgers and fried items like samosas, etc. are ordered and consumed regularly. This leads to indigestion, constipation, flatulence, hyperacidity, etc. This again is symptomatically treated with mild laxatives or antacids, etc. The Vata dosh, thus imbalanced, is responsible for producing heart attack. But unfortunately, once the mechanism of atherosclerosis was known, it was the cholesterol and the fat contents of the diet which were blamed heavily as a cause for heart attack. Even today, the concept has not very much changed. The market is flooded with fat-free substances to reduce the cholesterol and minimize the risk of heart attack. The canola oil, which was highly praised for its anti-cholesterol activities and was recommended for heart diseases, has now been proven to be more harmful than other traditional oils. Truly speaking, fats are necessary for the body and even in heart disease. If we consider simple logic of wear and tear of the body during various activities, it requires cleaning or servicing, oiling, not paying any attention to the body till we get heart attack or we are diagnosed as having IHD is like taking your vehicle to a mechanic when it stops functioning. A vehicle is a mechanical thing which can be repaired and serviced and put into action. But that is not possible with the body. If it is beyond repair or there is no chance to repair due to death, who is responsible for this situation? So one should just not concentrate on cholesterol and worsen the situation by reducing or even avoiding useful fats from our diet. One should try to really understand the reasons behind and try to avoid various causes at various levels. An addiction is yet another important reason for many diseases including cancer, heart disease, etc. Addictions are a short-term pleasure and a long-term evil. There are many other pleasures like music, sports and reading good books, etc. which are non-hazardous or on the contrary even more beneficial as well. But still, addiction should be considered as sort of disease, not very easy to get rid of. The best way is to control the mind in the first instance, and if addicted already, try to get de-addicted at the earliest. Heredity also plays an important role. We inherit good or bad qualities from our parents or ancestors. If our parents have suffered from heart disease, we are prone to this disease right from the birth. In that case, we have to be conscious to avoid other causative factors to minimize the risk. On the contrary, we should have the Rasayana and Panchakarma treatment to avoid the primary onset of the disease. Sedentary lifestyle is yet another important reason. With the advancement of physics, scientists have taken many efforts for physical comfort. Vehicles, elevators, air-conditioned rooms, easy availability of ready-made food have led us to sedentary lifestyle with no exertion at all. In order to keep our body fit, we need regular exercise, which is very much neglected. This results in weakening of heart and may lead to heart attack even on climbing the single staircase. So those with sedentary lifestyle need to have some exercise. One can opt for sports instead. The lack of exercise, overeating, heredity leads to obesity, which itself is the cause of many diseases like heart disease, diabetes, etc. It's better to control weight in the beginning of obesity, as later this is a very difficult task. One should have very firm desire to reduce the weight, and then only the steps can be followed. There are certain people who have a tendency of worrying unnecessarily and being under tension constantly. There are people who keep on finding reasons to worry. If they are unable to refrain from this deadly habit, they become victims of heart attacks, even though they are not overworked or stressed by their work. These kinds of people require constant counseling. Regular yoga practice helps them to come out from the situation and live normal, healthy life. It is rather the mindset which is responsible for the disease in these people. The situation remains the same. It's our attitude that decides whether to be happy, unhappy, neutral. For example, we are approaching a signal while driving a vehicle. The signal is green when we are away and turns red at the time our vehicle reaches the signal. Some people will accept this without getting disturbed. It is the neutral stage. Some people will start cursing the destiny and the consequences due to being held up at the signal and get very much disturbed. These are the people of worrying nature, trying to find reasons for worrying. They are prone to various diseases. There is a small group of people who will accept the red signal happily and would sing or have the pleasure of watching the traffic or people, etc. These are the best examples to learn from. If we develop this attitude from small instances, we can better handle bigger challenges with happy state of mind. 2. Purvaroop or pre-symptoms. Unfortunately, the pre-symptoms of heart disease are not felt as symptoms of heart disease. They can be constipation, breathlessness, and fatigue, etc. People approach us for discomfort or pain in chest. On examination, they do not reveal any disorder regarding heart, and patient is sent back with minor medication for digestive upset. Many a times, these people are very anxious and hence they have to be investigated at least for electrocardiogram, ECG, but that is found to be also normal. Sometimes they are admitted in ICU for observation, but nothing reveals. We also observe that some people have massive heart attack without any indication and not getting any chance for treatment, leading to death. One has to consider all the causative factors to have the proper judgment regarding proneness to disease. The website www.gadgilayurveda.com does the job very well. 3. Roop or symptoms. These include severe chest pain, profuse sweating, restlessness, breathlessness, and drop of blood pressure. Breathlessness on exertion or climbing stairs or going up on hilly road is a quite important symptom. These symptoms can be associated with obesity as well. In that case, it is better to investigate thoroughly to know the status of the heart. Upashaya. 4. Upashaya or the relieving factors. Generally, these people will feel better with rest and relaxation. Shavasana helps a lot. Unfortunately, people are not ready to accept rest and relaxation as a treatment in subacute conditions. I had a very strange experience. I was teaching in a class when one of my old students rushed into the classroom. She told that her father is restless and is having severe chest pain. He had a history of heart attack previously. I rushed to his house and examined. It was a cardiac condition, so I started with some medication and asked him to get admitted in ICU. I returned to my work. 2 hours later, the student again called me saying that her father is reluctant to get admitted. I again went to his home and tried to convince him for getting admitted. The reason he told for not willing for getting hospitalized was very funny. The previous doctor had asked him to stop smoking, which he didn't follow. So he was afraid of getting scolded for his negligence. I tried to convince him that it was the time to treat him. Ultimately, another cardiologist was invited and he confirmed the diagnosis with the ECG. Then doctor advised him to go to get admitted in a hospital where this cardiologist was ready to handle him. Even then, the patient didn't get admitted for the reason that he wanted to attend the court of law for some suit one day later. I told him that I will not give him any medications further and it is his responsibility to follow the advice. Ultimately, he got admitted in yet another hospital where he started smoking in the ICU itself. The doctor got annoyed and discharged him on the second day. Even then, he somehow survived during this situation but had a massive heart attack after 1 year with no chance of treatment. Generally, with the diagnosis, people are much stressed and depressed and have no desire to fight against the disease. They just want to go for angioplasty and bypass without thinking whether they can afford it or are they mentally prepared for it. If people are advised to reduce working hours or some of the responsibilities or have some rest and relaxation, they ask for a replacement with some more medications. It is funny to ask for replacement for rest and relaxation with medication. This is because of the notion that medication has a form of a tablet or medicine and not in the form of rest and relaxation. To be frank, whatever maintains balanced state of dosha is a treatment. So rest and relaxation is a treatment when you are overexerted. But people neither understand it nor follow it. 5. Anupashaya or aggravating factors. It is very well observed that indigestion, constipation, obesity, lack of exercise, stress, depression, anxiety, these all aggravate the disease. But no attention is given to these factors, and in spite of known diseases, people don't try to avoid the causes. This worsens the situation. 6. Samprapti or creation of disease right from the imbalance of the dosha. One has to understand all the steps starting from the imbalance of the dosha till the manifestation of the symptoms at an individual level. When all causative factors have been thoroughly considered along with the other factors like pre-symptoms etc., one has a better judgment and an Ayurvedic holistic management is very effective and successful. The treatment actually can be divided in two parts. 1. Treatment of acute condition. 2. treatment for avoidance of recurrence. 1. Treatment of acute condition. This is an expert's job. Generally, people don't approach Ayurvedic consultants in acute conditions. Ayurved even offers emergency medicines working in few seconds and saving life. I have successfully treated 5 cases of myocardial infarction but got them admitted in ICU after primary treatment. This is because of the social notion that modern medicine is the only scientific medicine that offers, in spite of the honest efforts in modern medicine, that offers scientific treatment in acute condition. If a patient dies in spite of the honest efforts in modern medicine, neither the party nor the doctor is blamed. This is proper. But the same rule is not applicable to Ayurveda. The Ayurvedic physician and the Ayurvedic system are blamed if the patient dies. So unless and until there is a change in the mindset of the society, it is risky to handle these cases through Ayurved. But Ayurved definitely has the potential and would definitely prove to be a better treatment later. 2. Avoidance of recurrence. Having been diagnosed as a cardiac patient, it is really a stressful situation throughout the life. With a holistic approach, Ayurveda provides a better and a long-standing solution to prohibit secondary or primary onset of disease. One has to consider all causative factors and plan the treatment in a holistic manner. The lifestyle and food habits have to be changed. Management of stress, depression, anxiety, etc., either through yoga and or counseling has to be done. Exercise, rest and relaxation have to be implemented. There are varieties of Ayurvedic medicines which improve the function of heart and circulation. The concept of dieting has to be changed. Refined oil is to be replaced by filtered oil, peanut, olive, sesame for cooking. Ghee should be consumed regularly. Ghee increases HDL, the good cholesterol, which falls in many cardiac patients. Ghee doesn't have any bad effect on bad cholesterol, so it is strongly bad cholesterol, that is LDL, so it is strongly recommended to have 1 to 2 teaspoons of ghee in both meals. On the contrary, vegetable ghee, hydrogenated oil, is dangerous and has to be avoided. But this is very commonly used in biscuits, cookies, fried items, etc. and consumed daily. Cheese and paneer are also not as good as their preparation is not in accordance with the principles of Ayurveda. A combination of milk is not good with fruit, salt or sour according to Ayurveda. Because Westerners have been accustomed to cheese for generations, they gradually should reduce the cheese or proceed for less processed cheese like cottage cheese and start getting accustomed to ghee gradually. The Indian society should not get accustomed to cheese and paneer, especially in Punjabi dishes. The fast food like pizza, burgers and even the Indian varieties like samosas, pakodas are worth avoiding. Only occasional consumption may not be troublesome, but frequent use is definitely harmful. The managerial sectors, those working in IT, BPO fields are etc. urgently need to pay attention to their unhealthy lifestyle and to improve it at the earliest. Even at the age of 30, it might be too late as the heart attack may steal away their lives. The HR departments of the companies and the health professionals should come together to save the young generation from health hazards. A serious thought has to be given to reduce the working hours, to have regular exercise, yoga, rest and relaxation with proper food habits and friendly, supportive atmosphere. Regular massage relaxes the body and mind, restores energy and helps in nourishing. That should also be practiced. In short, holistic Ayurvedic management is required to handle the cardiac condition and for prohibition of recurrence of the attack. I started getting cases of heart disease for quite a long time. There are various reasons behind this. Fears about the bypass surgery and non-affordability are the main ones. Most of the cases are in a dilemma whether to go for bypass or not. These are very dangerous and can be fatal even after successful surgery. The relatives and friends giving suggestions and advice play a vital role in creating a dilemma. So I request the patients and their relatives to think properly and make a firm decision. They should not deviate from their decision and should not feel guilty about it later. Bypass or angioplasty is a mechanical solution and proper treatment with Ayurvedic holistic management is required anyway. Unless and until we consider all causative factors such as heredity, stress, improper food habits, hectic life schedule and addictions etc., we can't treat the patient. Lack of such consideration leads to recurrence and need for repeated bypass surgeries. On the other hand, if these are well considered, there is no need of bypass in most of the cases. But then, what should we do in acute conditions? It is this fear which compels the patients and the relatives to go to bypass. I earnestly request the patient and his or her relatives to consider all aspects and then make a decision. The website www.gadgilayurveda.com provides a guidance for that. The main purpose of the website is as follows. 1. Identify the persons who are prone to heart disease. 2. Identify the causes. 3. Give suggestions for improvisation in lifestyle and thus for prevention of the disease. 4. Identify causes for recurrence and suggest ways to avoid recurrence. 5. Guide for Ayurvedic holistic management. The program works at various levels such as 1. Identify people prone to heart disease through express or elaborate checkup. 2. Identify the causes. 3. Give suggestions for improvement to prevent primary onset. If one has already been diagnosed as having IHD, ischemic heart disease or valve-related problems, 1. Identify causes and suggest ways to prohibit heart attack. 2. Revert the condition to normalcy with Ayurvedic holistic management. If one has already suffered from heart attack, 1. Identify causes and suggest ways to prohibit second heart attack. 2. Try to revert the condition to normalcy with Ayurvedic holistic management. If one has already undergone angioplasty or bypass, 1. Identify causes and suggest ways to prohibit next heart attack. 2. Try to revert the condition to normalcy with Ayurvedic holistic management. As regards valve-related or other problems, 1. Identify causes and suggest ways at least to maintain or to revert the situation. In a way, the program is destined to prevent, maintain or to revert heart disease at various levels. Full-fledged Ayurvedic treatment for IHD or heart disease is available in my clinics and in the clinics of the service providers listed under mapping of services. One may contact directly in the clinics.